Thank you everyone for joining us for this afternoon's webinar about over-the-counter hearing aids. Before we get started, just a few technical details. If everyone can please keep their microphone muted during the presentation, that would be helpful. Everybody will have the opportunity towards the end of the presentation to unmute their microphones and ask questions. If anybody would like to have captions so that they can see what we're presenting, there should be the option on your toolbar on your screen to enable captioning if that would be helpful for you. This webinar is being recorded, so if anybody misses anything, we can send you the recording. Everyone, again, please mute your microphones. You are welcome to either keep your cameras on or off. That is up to you. So welcome to today's presentation. We're going to be speaking about over-the-counter hearing aids. We will start with defining a few things about over-the-counter hearing aids. So over-the-counter hearing aids, everybody's talking about it now, but this actually has been a topic that has been discussed for the last 5 to 10 years. And has finally been put into effect. The final rule went into effect this past summer, August 17th, 2022. And the first over-the-counter hearing aids became available for purchase as of October 17th. The goal of the over-the-counter hearing aids rule was to increase and expand access to hearing devices for individuals. So on that note, the goal of the rule has a very positive purpose to enhance and increase access to hearing care for many individuals. However, what we're going to discuss today is whether over-the-counter hearing aids are appropriate for you as an individual, and hopefully at the end of today's discussion, you'll know whether this is an appropriate pathway for you. The over-the-counter hearing aids are meant for adults with perceived mild to moderate hearing loss, and the over-the-counter hearing aids are available for purchase without professional assistance, meaning it's a self-purchase without the need for a medical exam or testing by an audiologist. Okay. What is the definition of an over-the-counter hearing aid? So let's define that. When this new category of over-the-counter hearing aids came about, there needed to be a definition for the traditional category of hearing aids, which are the hearing aids that we all know up until this time, which were just called hearing aids, but now will be referred to as prescription hearing aids. So prescription hearing aids are hearing aids that are fit by an audiologist or a licensed professional, and they are the only ones that are allowed to fit and prescribe those hearing aids. The new category of hearing aids are called over-the-counter hearing aids, and these are available over-the-counter without a physician or a prescription and can be purchased directly in a store in person, online, or through mail order. We're going to discuss a few topics related to the difference between the over-the-counter hearing aids and the prescription hearing aids. We will discuss who fits them, who it's meant for, the degree of hearing loss, the type of hearing aids that are available in each category. So we will take this step by step. So firstly, we're going to talk about the degree of hearing loss that is appropriate for each type of hearing aid. So for the over-the-counter hearing aids, those are indicated for individuals that have perceived mild to moderate hearing loss only, versus prescription hearing aids, which are the traditional hearing aids, are intended for individuals with any degree of hearing loss, mild, moderate, even severe or profound hearing loss levels. And then related to that is how we can diagnose what degree of hearing loss a person has. So for an over-the-counter hearing aid, the definition is perceived mild to moderate hearing loss, which means that the individual person perceives or detects on their own that they have some mild to moderate difficulty hearing. They have not been tested, they just perceive some mild hearing difficulty, versus with a prescription hearing aids, those are prescribed by an audiologist or hearing care professional that has performed a hearing test and has diagnosed the exact degree of hearing loss that the person has. So let's discuss a little bit of the advantages of having an audiological evaluation and diagnostic testing by an audiologist. So firstly, as you can see here in this slide, when you come to the audiologist, we start by looking in your ears to determine if there's anything actually going on in the ears in addition to the hearing loss. We look to see if there's any wax, any blockage in the ear. We look at the size and the shape of your ear to determine what type of hearing aids would be appropriate for you. We look for other medical disorders of the ear, such as skin diseases, swimmer's ear, any growths on the ear. Then we go on to perform the actual audiological evaluation, otherwise known as a hearing test. Many of you have been in a test booth like this. This probably looks familiar to you. But let's just go into a little bit more detail of what happens when you go for a hearing test. So many of you have been through this. You know the fact that you have to listen to beeps and press a button when you hear a beep, but the hearing test actually involves a lot more than that. When we're doing the hearing test, we want to figure out and we want to diagnose the degree of your hearing loss. We want to determine the type of the hearing loss, which part of the ear is actually affected and is causing the hearing loss. Is it something that is a permanent hearing loss? Is it something that's caused by the middle ear, an ear infection? Is it something related to your hearing nerve? We do all types of tests. We test your eardrum mobility. We test your auditory nerve. We test your inner ear. We also test your ability to understand and comprehend speech and words. We test your ability to understand speech when there's background noise, which is a major complaint for many individuals. We also take a full medical history and discuss your specific communication needs and lifestyle in order to determine what is the best option for you for a hearing aid. Okay, let's now discuss which individuals each type of hearing aid is intended for. So as we discussed, the over-the-counter hearing aids are intended for adults over the age of 18 and for individuals with mild hearing loss that have no other complex ear diseases or disorders. Versus the traditional prescription type of hearing aids have a much more wider intended use. It is for any individual of all ages, including children, all types of hearing loss, all degrees of hearing loss, as well as individuals that have other medical conditions of the ear so that we can determine a type of hearing aid that can fit even with your medical issues going on. On that note, there are certain red flags or what we call contraindications to over-the-counter hearing aids. So if a person is experiencing any of these symptoms, they are not a candidate for over-the-counter hearing aids. First one would be a malformed or misshapen ear at birth, or any malformation of the ear that could have been caused by trauma to the head or ear. If a person has history of drainage from the ear or ear infections within the previous 90 days, history of sudden onset hearing loss, any dizziness, any wax or foreign bodies in the ears, any pain or discomfort in the ear, or any experience of dizziness. If a person experiences any of these symptoms, they are not a candidate for over-the-counter hearing aids. They should immediately be seen by an audiologist or an ear, nose, and throat doctor or medical professional. Again, in terms of who fits each type of hearing aid. So for the over-the-counter hearing aids, they are what we call self-fitting hearing aids. An individual can go purchase the hearing aids in a store, in person, or online, and needs to fit them on themselves. Okay, this can be done with the user manual, with the instructions. There may be some apps associated with that, but it is a self-fit hearing device. Versus the prescription traditional type of hearing aids are fit by a licensed audiologist or other hearing instrument specialist. And let's talk a little bit about the benefits of having a hearing care professional fit your hearing aid, okay? So the first step of the hearing aid fitting is determining the proper fit of the hearing aid and programming of the hearing aid. So we want to make sure that the hearing aid is the proper fit and sizing. We want to make sure that it is prescribed and fit based on your specific hearing loss, not just a generic hearing loss. We want to address any sound quality issues that you may have. We want to address any lifestyle or communications that you need, whether you need the hearing aids for work, whether you need them for family gatherings, or other purposes. We want to make sure that those hearing aids are appropriate for your daily needs. We will set up customized controls on the hearing aids. If there's any controls via a button or an app, those will be customized to your needs. Again, customized programs. If you experience any ringing in the ears or tinnitus, we can create programs for that. The next step is what we would call the hearing aid orientation, or teaching you how to use the hearing aids. So when you're fit with hearing aids with an audiologist, we will guide you and instruct you on how to use the hearing aids, how to put them in your ears, how to use them, how to use any controls, how to change the batteries or use a charger, any accessories or Bluetooth pairings that need to be done with your hearing aids. We assist you with that. How to clean and maintain your hearing aids. So these are all steps that we walk you through when you are fit with a hearing aid with a hearing care professional. In addition, we do various testing and measurements with the hearing aids on to determine that the hearing aids are fitting you properly. One of the testing that we can perform is called real ear measurements, where we take some measurements while the hearing aids are sitting in your ears. We verify that the hearing aids are working in your ear and customize the fit based on your ear, not based on an average sized ear. Again, going back to fitting the actual hearing aids. So there can be, when you go with a traditional prescription hearing aid, there can be many styles of hearing aids, many of which are custom fit to your ear. They're not a one size fits all. And we are able to achieve that goal by taking an impression of the ear. We now use a 3D digital scan that we take of the ear. And then with that scan, we are able to create a hearing aid that is custom fit to your ear, better fitting, improved sound quality, and also more comfortable for your ear. So related to that is the different styles of hearing aids that would be available in an over-the-counter hearing aid versus a prescription and professionally fit hearing aid. So the over-the-counter hearing aids, you can see an image here. They're a one size fits most hearing aid. You pick it up over the counter. It's a one size, one style, and a generic size. Versus professionally fit hearing aids, we have many different options of styles. We have an over the ear. We have larger and smaller depending on the degree of your hearing loss, the size of your ears. We have custom in the ear hearing aids as well. And there are other options that are not shown here for individuals with medical issues of medical disorders of the ear. We have other types of hearing aids as well that can be fit for those ears. Okay, some other things to consider if you decide to try an over-the-counter hearing aid and purchase an over-the-counter device. So when you're fit in our office or any audiologist office with hearing aids, many of we are required by state law to offer a trial period, warranties on the hearing aids, as well as a return policy. So something to consider if you are purchasing an over-the-counter hearing aid is to look at any of these options. They are not required to offer any of these policies. So it is in your best interest to check on the box if there is a return policy, if there is a trial period or warranties, if these devices can be connected to Bluetooth, and whether or not there is any manufacturer contact information on the over-the-counter device. In case you need some help with those devices, they are not required to put a phone number. They are only required to provide a website. So make sure that if you do decide to go ahead with this, you have all these questions answered. Okay, so to review some of the issues and topics that we discussed previously about the over-the-counter hearing aids versus hearing aids that are fit by prescription through an audiologist, we're going to just review some of the benefits of having an audiologist or hearing care professional. So firstly, you will get our expertise. So an audiologist or a doctor of audiology is a licensed hearing care professional that specializes both in the diagnosis and treatment of hearing loss, as well as tinnitus, balance disorders, and other disorders of the ear. And again, as we discussed previously, this is important because each individual can develop a hearing loss, different types of hearing loss in a variety of ways, and has different and unique communication needs for you as an individual. You will also develop a relationship with your audiologist. Our patients come back to us again and again to be followed, any follow-up questions with their hearing aids. Hearing loss, as we said, has many different causes, such as gradual age-related decline, Meniere's disease, ototoxic medications, other medical conditions. Again, an audiologist will assess your full medical history and learn about your lifestyle in order to determine a full personalized treatment plan, which may include hearing aids, may include other solutions as well, in addition to hearing aids. And again, we provide a long-term, long-lasting relationship and continuum of care with our patients. Trust. Trust is an important issue. We try to develop a relationship with our patients, again, to help you in all ways. Hearing loss can affect a person, not just their hearing day to day, but it can affect a person emotionally. It can affect a person's cognitive function. It can affect them at work. And so we are here to answer all of your questions related to any of those topics and issues that may be affected by your hearing loss. And again, this goes beyond just fitting the hearing aids and hearing devices themselves. So at our office, at Comprehensive Audiology, our goal is to provide our patients with personalized care so they can experience better communication and better hearing. We have state-of-the-art equipment to diagnose the hearing loss, as well as the latest hearing technology. And we hope to change each of our patients' lives for the better. And thank you for joining us. This will end the presentation portion of this webinar. Now I will open the floor to any questions related to any of the topics that we discussed, or any question related to over-the-counter hearing aids. So you can either unmute your microphone or you can hit the raise the hand icon. Okay, again, anybody have any questions that they want to turn the microphone on? There is an image of a microphone. If your microphone is muted and you have a question, you could unmute your microphone and ask any questions that you may have.
Hi, Doc. Do you take flex spending directly for hearing aids?
Do you mean your medical flex spending account?
Yes, that's correct.
Yes, we do accept that. This is, hearing aids are a medical expense, and yes, you can use your flex spending account in our office.
Great, thank you. This was very helpful. Thank you.
Anybody else have any questions related to over-the-counter hearing aids, or related to any questions about audiology or hearing aids?
Dr. Fogel?
Yes, hi.
Hi, I just want you to know this was very interesting, very informative, and I hope that everybody watching will understand how important it is to do this the right way. And certainly certainly I can testify to how fantastic being treated by an audiologist, being treated by Dr. Fogel, how fantastic it has been and how it has helped me in so many different ways. I thank you for the program.
Thank you for your input. Okay, I'm still here for a few more minutes. If anybody else has any questions, please don't be shy. Feel free to unmute your microphone and ask any questions you may have.
I just want to say that Dr. Fogel is the most caring person. I formed a wonderful relationship with her, even though she knows my hearing aids are not perfect yet, but we keep trying to get them perfect. And Dr. Fogel does not give up on us. Thank you, Dr. Fogel.
Thank you, Joyce. Anybody else have any questions? Okay, thank you everyone for joining us again. This is Dr. Esther Fogel from Comprehensive Audiology. Many of you on here already know me. Anybody who has not met me and has any questions, you can feel free to reach out to our office or email me. I am always available to answer any questions. And before we end, last chance if anybody has any questions that they want to ask here.